it takes all these really smart, like science minds to do the work we do, but it also takes all these really, really savvy policy advocates to be able to navigate the landscape. And I couldn't be more bullish about the work the PAA is doing, because we are literally creating a movement of movement. And I'm probably biased on this, but I feel like it's reached that point of unstoppable momentum.
The HFA pod is sponsored exclusively by Hapana.
Hello and welcome back to the HFA pod. I'm Tom Richards, Senior Advisor to Government Affairs at HFA, and I am thrilled to be this week's host. My work with HFA extends back over 20 years, and I am more excited than ever about what's ahead for the industry. Today's guest on the pod is Mike Stack, proud HFA member, founder and CEO of Applied Fitness Solutions, president of the Physical Activity Alliance, and chair of Michigan Moves, which recently launched the Michigan State Physical Activity Plan. I think Mike's story is especially compelling because he didn't start out as a policy expert or a professional advocate. He started as a fitness operator, focused on serving people and building a business. And over time, he became one of the strongest voices for advocacy and public health in our industry. Mike, thanks so much for joining us.
Great to be here, Tom. Thank you so much for having me.
Mike, I mentioned in the introduction that you're the CEO and founder of Applied Fitness Solutions. I think that would be a great place to start. Can you tell us about what I know as AFS?
Yeah, so I started AFS in 2007. I actually started my career in the fitness industry at a YMCA when I was 15 years old, wiping down benches. And that YMCA was actually a life-changing place for me. I was an overweight kid when I was growing up. My nickname in high school was actually Fat Stack. And so that has really driven me, throughout my career, because movement and being in that gym. I always hesitate to call it a gym it was almost a hotel workout room at this little YMCA, but I mean, it was life-changing for me. And so after I left the YMCA, I was working for Bally Total Fitness. That's where I started my career. I think probably half the people listening to this podcast will know who Bally's are. The other half won't remember them since they're long since gone. But really what was the driving force behind me starting AFS was really wanting to create a safe and inclusive culture for people to be able to move their bodies and exercise in a way that was meaningful for them, in an environment that they felt was safe. And when I say safe, I certainly mean physical safety. That's table stakes with what we do, but more that mental, psychological, and emotional safety. And it's really what I felt when I was in that little YMCA gym. And I looked long and far when I was starting my career to see if I could find an environment that provided that culture and that the environment of safety and trust. And I just couldn't find what I wanted. And so that's what caused me to start my own business. I think all of us that are in this industry, no one did this to become billionaires. No one did this because of fame and fortune. We did this because we legitimately wanted to help people. And I felt the best vehicle for doing that was starting my own business where I could shape the culture, both from the team perspective and the member perspective.
Mike, where's your business located?
So we are in Ann Arbor, Michigan. I'm a proud U of M grad. I actually moved out to U of M in 2000 to go to school, and I've basically never left. So we're here located in the Midwest in Ann Arbor. Go Blue.
And how many facilities do you have?
So we had 3 facilities prior to COVID, and we actually during COVID made the strategic decision to scale back to 1 facility to start to make our pivot towards more of a healthcare entity. AFS employs registered exercise physiologists, registered dietitians, and nationally board certified health coaches. So we employ more of a multidisciplinary care team model. And we realized if we were going to shift that operational model to something that was going to be more healthcare oriented, something that was going to be more outcomes driven, and something that was going to be able to effectively integrate with healthcare, we needed to retrench a little bit, and COVID gave us that opportunity. And since then we've been slowly but surely making the pivot towards more of a healthcare entity than just necessarily a traditional fitness entity.
Yeah, that's great. Thank you. And I'm looking forward to getting in more into what you're doing now, but maybe we can go back to the beginning. Um, this journey that's almost a 20-year journey for you. You're building this safe and inclusive facility. You're trying to build something, build a culture that you feel like is missing in the community. Quickly, you have to make payroll, you have to pay rent. Did you ever think about advocacy whatsoever in these early days of building your business?
The furthest thing from my mind. Kind of, to your point, when you're starting up a business, you're juggling credit cards, and I'll pay my business bills one month, I'll pay I'll pay my personal bills the next month, and you just kind of go back and forth. So no, here's the thing, Tom. It wasn't even that I knew enough about it to consider it. I didn't realize that I can play a powerful role as an individual business owner and exercise professional in advocacy. And truth be told, I really didn't even realize that until the pandemic. So from 2007 to basically March of 2020, advocacy was absolutely not on my radar. And then very quickly, like for many of us, advocacy and having a seat at the table became one of our primary concerns when COVID hit.
Mm-hmm. I think that's a really profound point that I want people to understand is that you didn't have a policy background. You weren't someone who was a poli-sci major or spending your free time at the state house. You were someone who was building a business. And then let's go to COVID, because it sounds like that was the first time when advocacy really popped up on your radar. Can you tell us sort of what was the first sort of steps in your advocacy journey?
Well, it was connecting with some other operators and owners here in Michigan and starting the Michigan Fitness Association. So like many states during COVID, we stood up a state trade association. And really, that was just to start to have conversation with the state about it getting reopened. And, Michigan, because of the approach that it took to COVID, was a little bit more heavy-handed in the state's oversight and regulation of reopening. So we were actually closed from March all the way till September of 2020, and then opened at a partial capacity after that. So I had a lot of time to sit and think and collaborate with other owners and operators around the importance of advocacy. But I'll tell you where the real inflection point was that caused me to really realize how much of a difference advocacy can make. It was February of 2021, and the Michigan Fitness Association had put in, working with some legislators, a line item to a piece of legislation that was advocating to give our industry in the state $53 million. And I was driving to our state capital, Lansing, to testify before our House Appropriations Committee for this $53 million. And I remember thinking, holy cow, there's no more impactful thing that I could be doing right now than this in this moment. And Tom, one of my core values is impact. And so for me, that was something that lit me up. And, long story short, we didn't get the $53 million, but as some people know, and as I think we did get $8.5 million for the industry in the state. And that was just, it was so profound because I realized that my voice and the voice of some of my close friends really mattered and really made a difference. And I think that dovetailing with my core value of impact really sparked my career, so to speak, in advocacy.
Yeah, that's an incredible story. Do you remember what it was like the first time you started making outreach to legislators at the State House in Michigan? Because even just to get that line item in the legislation, that takes some conversations and some relationship building. Were you a part of that initial process?
I was. And so in one word, it was scary because I never did this before. And I think we all have this perception in our mind of the intellect or the gravitas of lawmakers. I mean, I don't know, maybe less so nowadays, but broadly speaking, I think like we assume that the people that are in the halls of power know so much more than we do, and we're kind of going there hat in hand asking for money. So it was it was nerve-wracking, but I will say this: there was strength in numbers because I wasn't going there by myself. I was going there with other owners and operators. We also had, a lobbyist, a government affairs expert, who could help nurture those conversations. And I think that was a critical piece. I think without, his name is Jim Ryan. Ironically enough, he works for an organization called PAA, Public Affairs Associates. So this causes all kinds of problems for me with acronyms when I get into Physical Activity Alliance. But without Jim, I think as a coach and a mentor for us, I think we would not have been as successful as what we were. However, what I realized is that we were the experts on what we were advocating for, and they were interested in hearing from us, ultimately because we're their constituents and we're the people that helped them get reelected. So it was scary, but we had the mentorship and the coaching. But it was also reassuring once you started to have these conversations, you realize they actually want to hear your expertise.
Yes, I really want to underscore what you just said, that as a fitness operator, you're already an expert in policy that matters to fitness operators. There's nobody up at the State House who understands the business more than fitness operators. And those legislators, they work for their constituents. So you must have had that experience at some point. Was there a moment where you thought, wait a second, I'm the expert. They kind of work for us. And did it start to feel more comfortable eventually?
Yeah, well, I think the first time I had that realization was when we went to talk to a lawmaker's office, and I was talking to someone who looked like they were about 14 years old at the time, because
Yes.
it was a lower level staffer. Which, for any of us who've done advocacy, I think we've had this experience where we've walked into the room and you expect to speak to the lawmaker, and you're talking to a staffer. So instantly, I realized, well, I definitely feel like I know more than this kid. But even in conversations that I've had with lawmakers, and admittedly, despite all the partisanship and kind of all the difficult feelings we have today around politicians, I have found, particularly in the work we do in physical activity, that people are very interested in having a conversation with us. They're very interested in learning how physical activity and movement can make a difference. Inherently, they know that's the case, but they don't know the specific policies and systems that need to be augmented to make the active choice the easy choice. So they are actually willing to listen, and they do ask very good questions.
Mike, how was the fitness industry received by the state legislation? Do you feel like you needed to fight for a seat at the table when you were having those initial conversations? And did it help to have a coalition with you?
Yeah, first we had to find the table. We didn't even know where the table was initially, and so that then once we found it, I think the challenge was we had not built any trust and equity with the lawmakers. The first time we're coming to them is when we needed something, which I think everybody knows just from relationships in life. You build trust, you build value first, and then you ask. You don't ask as you're trying to build trust and value. So I think there were some challenges, and truth be told, and I think many of us know this, the bad actors in our industry over the years sometimes play an outsized role in the minds of certain people. Have it be, I was charged for a membership for 6 months that I didn't use, or I had this bad experience. So we were fighting against a couple of things. We were fighting against not having trusted relationships already established. We were fighting with dealing with some of the past indiscretions of some bad actors. And I think we were fighting against the perception that we weren't part of the public health infrastructure in the country. I think in part because of how we've positioned the industry over time is more of a entertainment product and a luxury product than an essential public health product. So we had to overcome all those things, and we're still working on those things, to be quite honest. I mean, these are things that we talk about here in Michigan. I know the HFA talks about, but what I feel good about now, both at the state level and the federal level, because of the great work that the team at HFA has done, is we now have those trusted relationships. We've built equity with lawmakers and their staffers. And then it starts to become easier to have collaborative conversations and ask for things.
Well, I'm really looking forward to asking you about your work nationally and in the policy and systems change. But I do want to ask you one more question on related to the local and state work that you've done. You mentioned testifying for $50+ million grant. That's some heavy pressure. Folks who may be watching this might think, I'd like to be involved, but I'm not so sure I want to be testifying at the State House for $50 million on the line. I'm wondering, what were some of the other folks in the coalition doing? Like, what were some of the other ways to contribute and support the cause if you're not testifying for $50 million?
Yeah, well, I think the first thing, it was just people staying informed. That was, I think, one of the best things that happened to the industry early in the pandemic, is that we became acutely aware and interested in things that were happening from a regulatory policy perspective. So, I always tell people, if you don't want to jump all the way to a congressional testimony, which is not as scary as what it sounds, but if you don't want to jump all that way, just being informed is the first step. Other people, and I think this was the big piece that made a difference, is they called their lawmakers' offices, they wrote letters, they sent emails. The reality is that makes a difference. And, when it's done at the state level and at the district level, you don't really need a high volume of people for it to move the needle, especially if it's happening in a really focused fashion. We had other people that were just, working to build the coalition. So I really think that, one, it's our professional responsibility that we are advocates for our industry. And then secondly, I also think it is our duty as citizens of a democracy that can actually advocate, that we take on that role that should exist in civic engagement. And we saw so many people doing that in so many different ways during COVID. And it took all of us to come out of it the way we did. So you don't have to be testifying. At the very least, you can stay informed, but there's a way to leverage everyone's strength and skill sets in the advocacy effort.
Yeah, I'm so impressed by what you and others accomplished in Michigan. I think there's wonderful lessons for the industry to learn. I loved hearing a little bit of your backstory, that I didn't know that you really weren't involved in advocacy up until 2020, which kind of tracks with our relationship, because I've been involved in government affairs related to the fitness industry for many, many years. And the first time I ever heard the word Mike, or the name Mike Stack, was probably 2021. And then quite quickly, you became one of the most important, impactful advocates we had in the industry. So there was very much a ramp up, a very quick learning curve for you. And I'm wondering, what made you choose to get involved with HFA at that time in some of the broader efforts?
Yeah, it was a very quick ramp up. For better or for worse, I'm either all in or I'm all out on something. That's kind of, I kind of live my life that way. And so I'm a very, very values driven person. So I mentioned earlier this value of impact, and throughout my career, I started making impact as an individual exercise professional, working with clients, and like that was fulfilling. But then I realized if I started a business and I trained other people, that could amplify my impact. And then as I started to realize how broad the impact of advocacy could be, that's what really sparked the fire. It was like, this is the answer to the impact need that I feel like I have to make. And it's not that I don't still enjoy running my business, because I do, and it's where I spend most of my time. But I realize when I'm doing things, either for HFA or the Physical Activity Alliance or Michigan Moves, when I'm doing that advocacy work, I am literally helping to raise all boats with that work. And so it really just goes back to that value of impact. My two other values are growth and service. And so they all dovetail really nicely with advocacy, because for me to do it, to your point, I had to be very growth oriented, because I did not know what I was doing. And it's a way to serve and give back to the industry that's given me so much. And it's allowed me to make, I think, a decent impact. And so that's why I'm so passionate about advocacy, is because it really aligns deeply with my values.
Yeah. Thank you, Mike. impact, growth, service. I think those are values that really permeate across the industry. We have this wonderful community of fitness professionals and fitness operators in the industry. Um, I'm wondering if someone's listening to this and thinking, I'd love to get started. I feel sort of a pull in some way to get more involved in advocacy. Are there some sort of things that someone could do in the next 30 days just to get started? Do you have any recommendations?
It's get informed. I mean, I think that that's it. Like for me, that was actually the first step. It wasn't like, oh, we're shut down for COVID. Let me go figure out where the state trade association is and just join up. It was, I had to do homework. I had to understand what was going on. At that point, there really weren't the mechanisms to understand all of the policy work that was going on. Now there are. HFA has a great advocacy newsletter that they put out. I believe it's monthly that Mike Kaczynski puts that out. I love it. It's digestible. It's sound bites of information. It's very approachable for someone who does not have a background in advocacy. Physical Activity Alliance, which I'm sure we'll talk about in a second. We also produce a great monthly newsletter that has a lot of information in it. And I think that really is the starting point, because then you can understand what is happening, and then you could figure out where to engage that's approachable and comfortable for you. And then over time, as you become more comfortable, you can figure out additional engagement. The other thing I'll say is that all politics is local, all health is local. So starting to develop relationships with your local mayor, your city council members, your chamber of commerce, all those people in your local community that, in all honesty, on the day to day, have a much bigger impact on your business than the things that happen in Washington. I would say that is something that's approachable for everyone. And I bet a lot of the owners and operators that are listening to this, your mayors, your city council members, your people that are in those offices, they're your members. Like you have those people in your facilities, and very easy to strike up a conversation with them on the workout floor and build trust and equity before you ask for something. And the perfect time to do that is when they're coming in to utilize your facilities.
Yeah, great point. All politics is local, and it's so important to build up relationships and build up that trust. And then I know at some point, all politics is local, but then you also became a contributor to FitPAC, which is the industry's political action committee, supporting members of Congress who champion our industry. I'm wondering if you could say a few words about your decision to support FitPAC.
Yeah, it wasn't a complicated decision. I think we all realize that money does influence things in politics. No matter if we like that or not, like that is the objective reality. I mean, I've heard, Liz Clark tell stories about, what the candy industry was able to wield, during COVID in terms of their political influence. And believe me, it's not just because everybody likes candy, and maybe everybody does, but it's because they put their money where their mouth was. And so for me, the $5,000 donation, which is, the max you can do as an individual, it seemed like such a small price to pay, knowing that there were other leaders in the industry that were putting that same amount of money in there. So when we did need to have a conversation, we actually had the financial capital to be able to have that kind of conversation, which we really didn't at the start of COVID, and it cost us dearly. And so I think, when we think from an ROI perspective, I think if we would have had the money and the influence that I think we have now at the beginning of COVID, I think we're not shut down for anywhere near as much time as we were shut down for. And what was the economic impact of that? So it was an ROI decision from my perspective. And it's just my acceptance of the fact that money is part of politics. And even if I don't like it, it's the game that we're playing. And we can't play that game with one hand tied behind our back.
Yeah, great points. Mike, I feel like in 2020, there's this existential conversation with the industry. Are we going to survive this? And I've been really heartened to see the evolution of the conversation towards how can we integrate more with the healthcare system, and you mentioned that physical activity is a public health issue as well. And I think that brings us to some of your work with the Physical Activity Alliance and the Michigan Fitness Alliance. And I know you've worked very closely with Mike Kaczynski, who's also the policy chair of the Physical Activity Alliance. Just can you say a few words about the work of the Physical Activity Alliance and what you're excited about there?
Well, the PAA, for those of you who are not aware, we're the nation's leading coalition of physical activity organizations. So the HFA is an organization, American College of Sport Medicine, American Heart Association, American Council on Exercise. I go down the list. I think we have 20 some odd organizations, and we do a number of impactful things. Tom, we talk about this a lot. We're the best kept secret that needn't be a secret anymore. I think the two areas, that I'll touch on that I'm particularly excited about. One is we talk about the physical activity planning process, and I'm sure a lot of people who are listening are familiar with the National Physical Activity Plan. The National Physical Activity Plan is the implementation plan for the physical activity guidelines for Americans that are put out by CDC. The plan gets updated every 10 years. Its next update will be 2028, 2029 range. And what I'm excited about that is because of what we're able to do with that in terms of pulling it locally. So here in Michigan is that example. We took the National Physical Activity Plan, we pulled it down to the state level, and we did work to individualize it to the state of Michigan. And PAA has the goal of all 50 states doing that very thing by 2035. And what we have built here in Michigan, along with standing on the shoulders of some giants like Eloise Elliott in West Virginia, Robin Shook in Kansas City, the late great Bill Cole, we have put together a framework that I think is almost a franchise model, if you will, to put it in terms that our industry would understand, of a state coalition that we could export. And that could be so impactful if other states work to do that. And then PAA is looking to put in place the infrastructure to provide technical assistance and supports to states in doing that. So that's one thing I'm really excited about. And then the other thing I'm extremely excited about is our It's Time to Move initiative. And It's Time to Move has the goal of making physical activity assessment, prescription, and referral the standard of care in healthcare. And I think we all agree that exercise is indeed medicine. However, it has not been systematically embedded into healthcare, and is far beyond the scope of this podcast to get into all the regulatory complexities that have prevented that from happening. But what the PAA has accomplished with other partner organizations over the years, like ACSM's Exercises Medicine, as an example, it is nothing short of astounding. We have physical activity as a vital sign inside of electronic health records. We're in conversations with the Centers for Medicare and Medicaid Services around the benefits designed for supervised exercise therapy. We're helping to inform and consult with organizations that are involved in innovation models that allow for physical activity to be a reimbursable service. So I really feel like we're on the precipice of finally getting physical activity and exercise to the rightful place that it should be as a efficacious and cost-effective healthcare intervention. And so that work is really profound. And there is so much policy work that underlies that. I mean, the conversations that I know Mike is in all of the time with Monty Ward and other lobbyists that are on our team at PAA around, getting the physical activity guidelines put into statute so it doesn't have to get re-upped every administration, and how we work with the regulatory agencies. And so it takes all these really smart, science minds to do the work we do, but it also takes all these really, really savvy policy advocates to be able to navigate the landscape. And I couldn't be more bullish about the work the PAA is doing, because we are literally creating a movement of movement. And I'm probably biased on this, but I feel like it's reached that point of unstoppable momentum.
Yes, we are creating a movement of unstoppable momentum. I love that. We talked about policy and systems change, and you mentioned how complex it all is. The regulatory side, the science underpinning, and even some of the lobbying and maneuvering around that can be complicated. But fundamentally, is there still about relationship building? Is that what this all sort of hinges on?
Yeah, I mean, that's everything in life, right? As they often say, it's not what you know, it's who you know. And for us to elevate these policy priorities as something that's actionable that can actually make its way into regulation or into law, we have to keep deepening those relationships. Because everyone is fighting for their more prominent seat at the table. Everyone has interests that they're looking to elevate. And I mean, let's be honest. Unfortunately, our industry doesn't have the deep pockets of big food or big ag or big pharma, all these other industries that you really can bring some financial capital to bear on this. So we have to lean on two things. One is our relationships, but two is the kind of the general goodwill and equity that physical activity brings. I've never once met with a lawmaker. I'll never forget the first time I did an HFA fly-in. My first meeting was at John Thune's office, and my last meeting was at Elon Omar's office. And I was like, well, this is an interesting day across the political spectrum. But yeah, they looked at things a little differently, but like both the offices agreed, like, yeah, we need to get people moving more. This seems like a no-brainer. And so we need to leverage that goodwill, but you can never not pour into relationships, because as soon as you stop pouring into them, they deteriorate. And then, the seat that we have at the table now, which we do have, we can lose it.
Yeah. Mike, you mentioned some of your experiences on Capitol Hill, and I think what you're referencing is the HFA fly-in in DC.
Mm-hmm.
I'm wondering if you can just share a little bit about your experience and what impact that might have had on you and how you think about advocacy.
I mean, the worst word that comes to mind, it's super cool. Like, I mean, to walk around the halls of the Capitol and just be in that environment, I just find, very energetic. But I think it was two things for me. I've done it twice. Both times I've done it, I was very excited and I was a little nervous to start. But as we got into it, first, the great thing that HFA does is they organize the whole day, which I just organized a small scale advocacy day here for us in Michigan. And it was bananas to do that. So like just the organization piece that Mike and the team do is great. But they also have, a trained lobbyist there with you. There's a professional that is there with you to kind of put guardrails on the conversations that are happening. But I think, getting into the offices and having the conversations, I think the neat thing is how openly and broadly accepting the lawmakers and their staffs are of what we're talking about. Like, we do not come in and talk about a controversial topic. Our friends in the food space don't even have that same kind of latitude when they go in there and talk. Like, we can all agree that being physically fit and being physically active is good for our physical, mental, and economic health. And so they tend to be very solution-oriented discussions, and we do tend to go in there with asks, right? I mean, you're building relationships, but you're also asking for something. But I think the HFA helps us position the ask in a way that allows the lawmaker or their staff to understand the greater good to society, and that's really, I think, the lens that we try to filter it through. So it's an exciting experience. It's a tiring day. It's normally hot. You're normally sweaty. You're walking around in a suit, but you feel very fulfilled at the end of the day.
I couldn't agree more. I really appreciate that perspective. Mike, but before we close, I just wanted to ask you if there's someone who's watching this right now, and they're still not sure if they should reach out to their local legislator or meet their member of Congress. Do you have any last words of advice for them just to get started?
Don't overthink it. Just do it. Like, I mean, our industry, I feel like you can't say this in every industry, but we are an industry that we take action, right? Like we have a bias for action in our industry. Not surprising given the fact that we're movement people. So I think just do it. I mean, that's kind of what I did. I just kind of threw myself at it and said, oh, what's the worst thing that's going to happen, right? They're not going to reply back. And it turns out that we started to have the conversations and they wanted to hear from me. And that's the big thing. Like you are a voter. They need you to get reelected. So they need you at the very least as much as you need them, maybe even more, depending on where we're at in the election cycle. So I would say just, make the reach out. If you're not comfortable with that right off the bat, start by getting informed, understanding what's happening from a policy and a regulatory perspective, and then find something that you are passionate about and dive into that. There's a great book, and I can't remember the author, but the title of the book is Democracy in Retrograde, is the name of the book, Democracy in Retrograde. And it talks about civic engagement and how you can get civically engaged. And it gives the example of, a mom advocating at her local city hall for a speed bump on her street so cars go slower so her kids don't get hit by cars. That mom was somebody who probably could care less about testifying before a city council, but she was really passionate about keeping her kids safe. So, like, we're passionate about what we do, but the question is there some specific thing in our industry that you are very passionate about? If you could find that thing, I guarantee you that'll overcome all the fear that you have around the initial reach out.
That's a wonderful way to end it. Mike, one of the things I appreciate most about your story is that it shows that advocacy isn't reserved just for policy experts or people in Washington. It's something that operators can grow into over time. And in fact, being a fitness operator means that you are already a policy expert. That's a theme that came up again and again in our conversation, that we are experts on the issues that matter to fitness operators. I think that's an incredibly important message for our industry right now. So thank you for sharing your story. Thank you for all that you do for our industry. And thanks so much for joining us. Great to chat with you, Mike.
Thanks so much, Tom.
Welcome to the HFA Update.
This week, HFA held its 2026 Fly-In and Advocacy Summit, where more than 100 fitness industry executives came to Washington, D.C. to share their stories with members of Congress, just like Mike Stack described in this episode. You can check out photos from the event at healthandfitness.org, and maybe those photos, along with Mike's journey, will inspire you to join us at next year's Fly-In.
The HFA pod is sponsored exclusively by Hapana,